Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing one additional death due to COVID-19. I'd like to send my condolences to their family, friends, and loved ones. Our current 5-day COVID-19 test positivity rate is 8% provincially and 8.7% in Winnipeg. 251 new cases of the virus have been identified as of 9:30 this morning, bringing our total to 39,524. There have been more than 800 cases reported over the weekend, and including today. And if we look at March compared to April, there's a 110% increase in cases. Just comparing April, we saw 4,800 cases, a little over 4,800 cases compared to 4,100 cases in October of 2020. So this is why we put stronger public health orders in last week, and this is why we're asking Manitobans to stay home. We need to reduce the number of contacts we have, and the best way to do that is to stay home as much as possible. We need Manitobans to continue to abide by the public health orders, to minimize the amount of contacts they have outside of their household, to follow the fundamentals. And we certainly recognize that people are tired of this pandemic, tired of these public health orders, tired of hearing about the fundamentals. But if we look to February and March of this year, we can see that these measures work. We brought our case numbers down. We reduced the strain on the healthcare system, but once again, we see these numbers climbing. And these numbers only climb because we're increasing the amount of contacts we have. We're increasing interactions. And the best way to reduce that is to stay home as much as possible. So we've been here before, and so we know exactly what we need to do. And as we do that, as we decrease the amount of contacts we have outside our household, we're going to see those numbers decline. But right now, we again see our numbers climbing. We're seeing the increasing demands on our healthcare system, on the ICU. We know that there's many Manitobans still waiting for procedures that were delayed because of the strain on the healthcare system during our second wave. And so we can't be put in that place again. So we need Manitobans right now to continue to step up, decrease the amount of contacts we have, stay home as much as possible. So we just wanted to clarify a bit of the transmission of COVID-19 between the airborne versus droplet transmission. And sometimes a common place where there's some confusion with it. So respiratory viruses are transmitted through droplets of various sizes, and those droplets can be droplets that are larger. They're fall to the ground rather quickly. And this is, droplet spread, as we say, and this is where we get that 2-meter distancing. So by far, COVID-19 is spread through a droplet transmission. So when someone speaks, coughs, sneezes, those droplets go into the air. They usually drop fairly readily, and that's why physical distancing is effective. When we talk about airborne spread, these are when particles are much smaller, stay sustained in the air, and can be transmitted over long distances. And so typically COVID-19 is not predominantly spread in that manner. It can be aerosolized with some medical procedures. There's some rarer reports of of transmission in distances further than 2 meters. But for the most part, COVID-19 is spread through droplet spread, and that's where we get that 2-meter distancing from. We do know that because it's spread through this route, ventilation is also important. That's why we have capacity limitations where people gather indoors, especially for a prolonged period of time. We recommend everyone ensure their ventilation systems are adequately functioning. We know that even opening a window can improve ventilation, so if weather permits. And it's also why we talk about being outdoors. Outdoors is much less a risk. Wearing a mask, a medical mask or a non-medical mask, can reduce the amount of droplets that are spread. And so just like all public health approaches, we combine modalities. And so if we talk about using a mask and physical distancing and staying home when ill, hand hygiene, reducing crowding, all of these combined start reducing our likelihood of transmitting that virus quite substantially. But that's why we always talk about the fundamentals. All of these things combined is what will decrease that transmission. And then, of course, if we just reduce the amount of contacts we have overall, and that's the purpose of those public health orders, we're going to see case numbers go down. We can't transmit that virus to people that we're not in contact with. We can look at our measures again compared to other flu seasons. We've had only 3 cases of flu reported this year, which is dramatically down. Last year we saw over 1,800 cases of the flu, and this again is contributing, partially contributed by COVID being the predominant virus being spread, but also these measures of reducing our contacts, staying home when ill, the fundamentals also reduce the likelihood of spreading other respiratory viruses, which we've demonstrated this year. Certainly our best tool right now against COVID-19 is the vaccine, and that's what's bringing us that hope for the future. The optimism we have for summer, but we have to realize we're not there yet. Many Manitobans have been vaccinated, but there's many more that have not had that opportunity as of yet. So we need to keep down this transmission until we can get all Manitobans access to that vaccine. We need Manitobans to make an appointment for a vaccine as soon as they become eligible. The quicker we get the majority of Manitobans vaccinated, the quicker we can start looking at loosening these restrictions. The vaccine is, our best way to protect ourselves, but also the people around us. So right now, we need to stay home, stay focused on the fundamentals, stay focused on bringing these case numbers down so we don't overwhelm our healthcare system. And in addition to that, we need to get vaccinated as soon as we become eligible. So I just reiterate that for now, we need to stay home as much as possible, limit our contacts outside our household. Outdoors, certainly less risk, but not zero risk. So again, mind that spacing when you're outdoors. Don't be in large groups. And if you can't be spaced, then wear that mask outdoors. And this also relates to garage sales. So I know garage sales are very popular in Manitoba. Right now, they're not allowed under our public health orders. The messaging is to stay home as much as possible, to limit our contacts outside our household, to not have any visitors, with very few exceptions, on our private property. And so that includes garage sales. So these orders are in effect until after the long weekend. And so we need Manitobans to delay any garage sales at this time. Also related to that is campsites. So campsites are considered a private residence. Again, we need people to reduce the amount of contacts they have outside of their household. And so campsites are only people in your household allowed there. There aren't any visitors from outside your household allowed. Again, that's keeping our contacts down. And so these orders, again, are in place till after May long weekend. And so we need, to address this third wave, we need all Manitobans to do their part. So we need to adhere to these current orders, and then at that individual level, take those additional steps to reduce the amount of contacts you have outside your household. Stay home as much as possible, follow the fundamentals, and we'll once again start bringing down these numbers like we've done in the past. So thanks, and happy to take some questions.
Thank you, Dr. Roussin. A reminder to our reporters on the line, we'll have one question, one follow-up. We start today with City TV and Mike.
Yeah, good afternoon, Dr. Roussin. A question: with all Indigenous 18 and older available for the vaccine now, what kind of impact could that have on numbers across Manitoba and ICU numbers? Just what kind of effect can this have with good vaccination turnout?
Yeah, and so what we've presented before on data showing that Indigenous Manitobans are more at risk of severe outcomes and more at risk of of becoming a case of COVID. So just they're disproportionately affected for a number of reasons. And so just like our vaccine program, the targeted approach, we want to try to protect those most at risk, and especially those most at risk of severe outcomes. So the idea is that we're going to see that disproportionate effect somewhat offset, and that's what we're looking for, the equity in the battle against COVID. We don't want to see groups that are disproportionately affected, and we're going to target our vaccine campaign in that manner, and it's also the best way to reduce the impact on our healthcare system.
And then my second question, if we aren't able to lower our numbers in this round of restrictions, would you be able to tell us what the next restrictions may hold, what is on the table?
Well, I can't speak to anything specific. We always say, and it's true, nothing's off the table, and certainly we have to protect Manitobans. We have to protect our healthcare system. We can't see our healthcare system be overrun. So if our numbers continue to climb, we'll have to take further measures. And so, I can't speak specifically to what those measures would be, but if required, then we'll need to adjust the public health orders.
Up next, from the Winnipeg Free Press, Katie May.
Good afternoon, Dustin. I wonder if you could provide that it's something within schools they were infected. So what are contact tracing?
Breaking up for most of that. I couldn't get really any of that question.
I'm sorry. Could you provide? Because you said it's been not.
Yeah, I wonder if we can do something with the connection there. I can't hear the question.
Okay, we'll move on. Perhaps Katie May can dial in again, and we'll try before we close things off. So we'll go to Global now, and Joe.
Hi there. Afternoon, Dr. Roussin. A local doctor is worried about ICUs filling up quickly over the next couple of weeks. Is this a concern you have right now? And how high would the cases have to be to threaten the system?
Well, it certainly is a concern, and that's why we adjusted the public health orders last week. We know that that increasing demand on the healthcare system, both ICU and medicine, puts strain on the healthcare system. It then compromises the ability to care for non-COVID patients as well. So we have to have quite a bit of concern about the healthcare system's capacity. So we're watching that very slowly, or very carefully, sorry, and. As far as specific numbers, it depends on a number of things in there, the rate of ICU admissions, as well as the trajectory. So right now, as these numbers that we have, this is putting strain on our healthcare system. So we have to get these numbers down. We know we put in public health restrictions last week or adjusted them, and so we're not going to see the benefit of those for another week or two. But we do need to be very careful with the numbers we're seeing right now.
Thank you. And I just want to follow up on the droplets and the aerosols that you touched on. Apologies if I repeat something you already said, but I'm just hoping to get a clear answer here. But we've heard often that the COVID is spread by droplets. Dr. Atwell said last week that the virus is not airborne. However, on Friday, the WHO updated its transmission information saying, quote, longer-range transmission is possible in poorly ventilated/crowded spaces because aerosols remain suspended in the air or travel farther than 1 meter. This would include places like our schools. So is COVID airborne, and how could you ensure schools and classrooms are safe given the poor ventilation and extended time inside?
Yeah, so the issue here is that, transmission of a virus, just like, really anything in medicine, is not binary, right? So there's nothing that's, it's droplet or aerosol, and it just, at 2 meters, it just drops. So there is a bit of that gray area. So certainly COVID is predominantly spread by droplet. That's by far the transmission mechanism that that this virus is spread by. In certain circumstances, there's been reports of transmission wider than that 2-meter distance. We wouldn't say we wouldn't classify it necessarily as airborne. If we look at, say, airborne, viruses, chickenpox or measles, just being in the same room for really any amount of time as somebody, you'd be considered a contact. That's not the case with COVID. So there is a gradient. By far, it's spread by droplet. But this is why we try to decrease capacity in places. We do recommend adequate ventilation if at all possible. But by far it's spread by droplet.
Okay, we understand Katie May has dialed back in round 2 from the Winnipeg Free Press. Katie May.
Good afternoon. Can you hear me now?
Yes, go ahead.
I'm wondering if you can tell us more about in-school transmission of the virus. Previously, you've said that it's not being significantly transmitted in school, but we've been hearing about anecdotal cases of students and teachers who believe they were infected in school. So what are contact tracers seeing now in terms of the in-school transmission?
Yeah, and so certainly transmission occurs in school, and occurs where in the community as well. So by far the cases that are associated with schools are acquired outside of school. So certainly there is transmission that occurs, but for the most part, the education system has done quite a good job of keeping things safe within schools. We know that a lot of this transmission is occurring in activities outside of school, so this is why we're using our typical public health measures, case identification, contact tracing, isolation right now, plus all of the safeguards within schools to minimize the risk of transmission. Of course, nothing can eliminate risk.
Okay. Related to that, what is driving new infections and clusters of cases in Manitoba right now? You've previously said that private gatherings have been the driving force, but how significant is transmission in places, workplaces, retail stores, churches? Where are we significantly seeing clusters of new cases now?
Yeah, and so it is widespread. I'd say right now, very significant transmission is occurring in gatherings at private residences and other social gatherings. So that's you saw the the large target of that in our last public health orders, but it's being spread in community. So we're seeing it any place where people gather. We're seeing workplace clusters. We certainly see clusters related to faith-based organizations. And transmission in almost any indoor setting, but the predominant spread right now was those private gatherings, social gatherings.
From CJOB, Will.
Good afternoon, Dr. Roussin. Manitobans may be seeing these daily trends, cases well over 200 nearly every day, test positivity rate around 8% or so, and think we're close to hearing about new restrictions, perhaps even in advance of when these current restrictions expire. What would be your response to that?
We need to protect Manitobans. We need to protect the healthcare system. So if we're seeing that these restrictions aren't achieving the goals that we had for them, then we may have to adjust our public health order. So we're not set to any time frame. We're going to do what it takes to protect Manitobans.
Okay, thank you for that. Follow-up question. I'm wondering, since the beginning of this year, January, was it ever reasonable to think Manitoba would not be met by a third wave of the virus?
We were anticipating that a third wave would come. I think that we were quite optimistic having the vaccine, but we knew that the quantities would not get us to a real population level benefit until summer. So it's very likely that we are going to see a third wave. The timing of that or the trajectory is largely unknown, but certainly we were prepared to see a third wave.
Up next, from the Winnipeg Sun, Glenn.
Yes, Glenn Dawkins from the Winnipeg Sun. This weekend, there was another gathering at the Forks. I think the third in as many weekends. Might we expect some changes to the enforcement orders? I know the Premier hinted about it last week. Do you think we might see changes to the enforcement orders that are currently, or at least the way the orders are being enforced?
Well, I think that the public health orders are in place. The messaging is important, and then certainly enforcement is one aspect of it. So I can't speak specifically to the any changes that are coming for enforcement, but we do know that is a significant component of all this. Most Manitobans follow the orders. We know that those who don't put us all at risk, and so enforcement has to be a part of it.
This past weekend we had 800 new cases, over 800. Last weekend 700. I know you've been asked about possibility of new health orders. Your comments on these, what seem like we've had 200, I think, every day for the last week or so. Obviously, these are not encouraging numbers. What would you say on these numbers?
Yeah, these are concerning. We're seeing concerning numbers right now, just the absolute case numbers. We're seeing a concerning trajectory going up in essentially every indicator. And then we're starting to see that strain on the healthcare system. We're starting to see people admitted to ICU. We're seeing younger people being admitted to ICU. So we're concerned. That's why we adjusted the public health orders last week, and we're going to follow things really closely. We need Manitobans to act now. We're not back at normal. We do have a reason to be optimistic about this summer. We have vaccine. The vaccine's rolling out. Quantities are improving. But right now, we need to do whatever we can to limit the transmission of this virus. The best way to do that is to stay home as much as possible.
From CBC Radio Canada, Camille.
Hi, Mr. Roussin. My first question is about the most recent health restrictions. Specifically, if separated parents share custody of their children, say 2 weeks at one house and 2 weeks at the other, are these parents, if they live alone apart from the moment at which they have their kids, are they allowed to have one designated visitor or not?
So for the purposes of shared custody, there's an exemption for that. So people who are part of a custody agreement and that visitor rule, there's an exemption for them.
All right. And on another matter, just to clarify, are there any plans or possibility to eventually put all schools on a red code or go back to distance learning for all?
So we don't have any immediate plans for that. Like we've said always, nothing is off the table. Right now, the significant amount of transmission that's occurring in those age cohorts is happening outside of school. And so closing the schools won't have a large benefit on the transmission because the transmission's occurring someplace else. So right now we know there's a lot of benefit to keeping the kids in school. We know that education has been doing a tremendous job at decreasing the risk of transmission within schools. And so we're going to follow it really closely, work along with education, and we'll adjust things if required.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. On that note, back in the fall, we had test positivity around 14-15% rate province-wide. We didn't shut down schools. You did shut down schools in the Hanover area when you had community transmission around 40%. Now we have variants, and that kind of makes test positivity rate even a more important indicator. You can't let it go as high. So where's the threshold? Where does provincial or Winnipeg test positivity get to? What is the trigger point then for closing those schools?
Yeah, so we don't have a single measure, and you're right. The variants do change a lot of this, and so we are dealing with a much different virus than we did in the second wave. So we're watching it really closely. The real issue is anytime we close things or restrict things, we're doing so to decrease the transmission of the virus. So it wouldn't make sense to just go to remote learning in schools when we know all the transmission, or not all of it, but a significant amount of that transmission is occurring in activities outside of schools. So if we're concerned enough to a point where there's so much community transmission that we need to go to remote learning for schools, we need to also reduce or eliminate those other type of activities where we do see these this transmission going, and so that's the after-school activities, the sports, and as such. So right now we're not in a position where we need to do that, but we're watching really closely.
Okay. We are hearing anecdotal reports now of people waiting 3, 4, 5, 6 days to get their test. A few months ago, it was as short as 20 hours. Obviously, case volumes are on the rise and test positivity is up. More people are getting tested. We see that with the daily test volumes averaging in the 3,000 range. How long is the average test turnaround right now? And what are you guys going to do to put resources back into testing?
Yes, I don't have the exact number there, but all the things you listed are what's the factor, right? Increasing testing, test positivity increasing also puts increasing demand because it's harder to pool those samples. And so I don't have the test turnaround time. We have heard anecdotal reports as such as what you've been mentioning there. So we've done a lot of work in that second wave and subsequently to ensure we have a lot of lab capacity and can get that test turnaround time moving. So we're going to definitely continue to look at that and ensure we're getting an adequate test turnaround time.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. I'm going to ask you the question that I think inevitably leads to the balance answer, but given Nova Scotia's success at clamping down numbers and moving to a virtual lockdown, even when case numbers and other indicators are fairly low, or certainly lower than we've seen, why is Manitoba not doing things like moving to a one-household bubble or shutting down schools and non-essential businesses, simply to keep people at home and reduce that movement that leads to transmission?
Yeah, so I'd say that we have had very strict restrictions for most of late winter and into this early new year, and right now we're quite restricted. We don't even have the household bubbles right now. It's really no gatherings at all on private residences. So we do have very restrictive orders. We do have the ability to move them further if need be, but we've just enacted the changes last week, so we need to still see what the benefit is of that. And then, like you mentioned, there is that balance, right? These restrictions have their own implications for health. And so we do try to find the balance. We're obligated to use the least restrictive means for these public health measures. And so we really strive to find that balance.
And the Premier and the Governor of North Dakota are working on a plan that could see school workers, teachers, and other school workers go into North Dakota, receive a vaccine, and come immediately back. We know one of those truck stop areas that's been dealing with truckers is about half an hour over the border. Were you consulted on that plan, and do you have any concerns about that sort of cross-border activity?
Yeah, so public health has been involved and will continue to be involved on that. And so anything that's going to require travel outside of Manitoba and include exemptions for isolation upon return is going to have public health input. Of course, it's going to have federal buy-in on that as well, because those are the federal quarantine requirements. But yeah, definitely we would have to ensure that people getting vaccinated are going for the sole purpose of getting vaccinated with really no other contacts and returning directly home. So we'll continue working on that plan. We're just I think as this third wave is here, we're looking to get as many Manitobans vaccinated as quickly as possible.
And our final reporter today from CTV, Michael.
Hi, Dr. Roussin. We're seeing that younger people are making up a larger proportion, the largest proportion of active cases in the province, particularly 20 to 29-year-olds. I'm wondering why you think that is. Is it a simple virtue of this is the age group that isn't being vaccinated? Would like to hear your thoughts.
Yeah, so there's a number of things. We know that the variant is in other jurisdictions has affected much younger people with severe outcomes. So we know the variant itself is playing a role on this. We know that it's very likely related to the success of the vaccine, that we've vaccinated much of our older cohorts, so we're not seeing a lot of transmission in those cohorts. And then we also saw in the second wave that those younger cohorts are the ones that are most active. They're working more frequently in higher risk type settings. And we saw early on in our second wave that those younger cohorts really drove transmission early on.
And then I guess my follow-up is you just mentioned how those in retail settings are at higher risk. You mentioned earlier about an equitable vaccination strategy. So why not vaccinate either those in retail, everyone in retail working settings, or everyone 18 and older?
Well, we have some of this targeted approach, right, where we're seeing a lot of transmission going on, that geographic targeting that you've seen. And really, it just comes down to access to vaccine, right? We just don't have the ability right now to open up to everyone over 18. We are moving there quite quickly, but right now we're doing that targeted geographic at the same time as moving down the age cohort.
Thank you, Doctor. This concludes today's media briefing.